My name's Bridget, and I'm a fellow in training with Evidence in Motion, and we're filming a mentoring session. And this is Liz. She's the resident, and she's going to do a quick reeval with Cindy, and then we'll talk about treatment and then follow up with some mentoring at the end. So I'm going to turn it over to Liz. Why don't you go ahead and present the patient and her demographics, and then we'll do a quick rescreen.
So Cindy is a 40-year-old female. She works as a teacher and also does some nonprofit work with an organization. She underwent anterior cervical disc replacement of C5 and 6 in March 2012. This was following her initial injury in February 2009 she sustained in a motor vehicle accident. Currently, after surgery, her main complaints are muscular tightness, stiffness, and weakness in the lower cervical and upper thoracic spine. Her pain is from a 2 out of 10 at best to a 5 out of 10 at worst, and aggravating factors are prolonged positions or postures, a long work day, and just feeling fatigued after doing a lot of activity. And alleviating factors are rest, ice, and medication. Is that accurate? So today is Cindy's second visit, so her formal measurements were taken at the first visit. So today we won't be taking those, but we are going to do a few asterisk signs for retest purposes, just to kind of reevaluate where she is at today.
Great.
So I'm just going to start with that range of motion. So I want you to look straight ahead, and I just want you to look down to the floor, and just kind of let me know how that feels today.
Up and down don't tend to bother me as much as to the side, so
side.
that doesn't bother me.
Okay, go ahead and look up to the ceiling. Good, same there, pretty good. Okay, go ahead and look over your right shoulder. A little bit there.
Yeah, that's about it.
And you have pain with that?
Yeah, it gets real stiff, and then if I try to push it, that's when it starts to hurt on this side through down to here.
Okay, so kind of at the starts in the neck and then kind of comes down a little bit. Okay, and then when you come out of that position, does that go away?
Yeah, it releases.
Okay. Anything in the arm?
No, I've been lucky. Nothing has bothered there.
Yeah, that's really big. Okay, to the left. And how does that go there? So a little bit more movement to the left, but still, is the intensity as bad to the left?
It doesn't seem to be, but it still gets real stiff, but I don't have the sharp pain go down.
Okay, more localized
Yeah.
whenever you're to the left. Okay, and then just bring your right ear down towards your right shoulder. Good. How does that feel compared to looking over your right shoulder?
It doesn't hurt, but I just feel like I can't get it to go
Yeah.
further.
Which is why you're right.
Yeah, I want to cheat and do it that way because I can't go any further.
Okay, so a little stiff. And then left ear.
This one's a little, that one hurts a little more.
Yeah, and doesn't move as well either.
Oh, that right there.
Okay.
That's as far as I'm going.
Okay, so I didn't really do overpressure because of the surgery.
And
Right.
no need. You really picked up the pain without doing overpressure, so absolutely.
Okay.
Yeah.
So right rotation and left side bending are pretty much my asterisks there. Those were the most intense and the most limited as far as mobility.
Good. And what I would add in here is let's just do a quick screen of her shoulders, maybe
Okay.
movement of thoracic spine. Are you writing on the blackboard?
Not right now, but I'm doing a lot. I'm writing grants right now, so
Okay.
I'm doing a lot at the computer. So I'm trying to do like you tell me and have better posture, but I
Good.
catch myself
Yeah.
doing this a lot.
Yeah, so we'll remember
Yeah.
that too for our exercises.
Okay. So for your shoulders, just bring both up ahead. Very good. Any problems there? Okay. And down. And then I'm going to have you just do out to the side and up. And any problems there?
Yeah,
Good.
great.
Okay, reach in behind the back, like if you were to do that.
Yeah, I don't have a lot of reach, but
No,
yeah.
you don't. Go ahead and do the other side. But you really don't on either side.
So equal.
Yeah, and no symptoms reproduced with that. Okay, So it didn't reproduce her while she's here, so I don't really think that's a big problem. For thoracic, I'm going to have you turn and face that way. And probably a PA is how we really need to assess, but I sometimes do just kind of assess the movement here.
Good. Any tenderness? And tell me why you're looking thoracic. What are you thinking?
Well, her trauma was cervical, the surgical trauma in cervical. So, but we need her thoracic to move so that her cervical is not getting stressed, extra stress. So she's not hinging right at C5-6, especially when she's sitting writing grants.
So does that make sense to you, what Liz is saying? If your thoracic spine's stiff, you're going to hinge more in your cervical. So we want to teach you how to stabilize your neck and how to get movement through your thoracic spine.
Okay.
Yeah.
And even just, you can see that she does hinge right at C5-6.
So where are you thinking she's going to be stiff?
C7, T1, upper thoracic,
Exactly.
mid-thoracic, and she is. I mean, it
Exactly.
feels stiff with that.
Good.
So,
You want to do check first ribs?
yeah.
Let's do that.
So Cindy, I'm gonna do this one first because left rotation is less.
Good.
Just so she kind of knows what I'm doing. You okay there?
Mm-hmm.
Okay, I'm gonna bring you forward. And I don't really feel any restriction. Do you feel anything there?
Mm-mm.
Good. So I'm gonna do the same thing to the other side.
Pops and
Just some palms.
You need
Okay.
WD-40.
Exactly.
Yeah.
But we won't go quite as far because I know that side. And I can already feel some tissue buildup.
Yeah.
Yeah, and about right
Okay.
there.
So good. So we need to work on first rib maybe. We'll do PAs on thoracic, so we'll check that. So you want to, since she's sitting, you want to maybe do a couple of techniques for that first rib and sitting?
Yeah, so Cindy, I'm going to have you scoot just to the right just a bit. And I'm just going to go ahead and get on this here.
Yeah.
Will they be ready?
Yep, I do.
Okay. And for her, I will probably stick with immobilization, and because I'm better at mobilization
Yeah.
right now.
Yes.
So I'm going to put this arm just up on my knee. Just let it relax. So you haven't had any numbness, tingling. That's
I've
really
been very
good.
fortunate.
Yeah.
Yeah.
So there's a couple of ways to treat this: muscle energy or mobilization. I kind of like the mobilization better. I side bend and rotate her that way. And then just, oh, I need to do some side bending here too. You okay there? And then just do the mobilization.
Good. And I know, with the camera and all this and that, you're interacting with me, but in real life, talk to Cindy as you do this. And I know you do. It's just this is a little artificial.
Yeah.
Yeah.
So, Cindy, with your first rib, a lot of times with any neck or shoulder problem, almost everyone now, we check this because it can just, if there's tightness in those muscles in the neck, they attach to the first rib and they can kind of just pull it up and it gets kind of stuck. And so that's what we're working on. Your left one is a little bit elevated. So I'm just trying to get it to move.
And then let's remember and show her at home how she can do that herself with
Okay, with a strap.
Yep, with a strap.
Still doing okay?
Good. I like your angle of the first rib. I like your
That one feels
positioning
better.
there. And typically with this hand, when I do this, your forearm is short, so I would come off and get more of the support in the neck. And then when you do this, I think you can gain enough slack by this. I would just leave her neck
Oh, okay.
neutral. Yeah.
That probably feels better too, doesn't it? Or just feels more supported.
Yeah.
There you go. That's great. But again, I like that first rib angle. Looks good.
Okay.
Great. All right. So, just real quick, let's recheck that and then. Here.
You okay there? Definitely less tension under my left hand, and then she gets through that.
That looks better.
Yeah.
So let's just check her right and left rotation too.
Okay, so go ahead and turn to your right side. Normally I'd be on the front of her, but
Right, I'm here. I can watch her.
good. How's that feel?
Better, actually.
Good.
Good.
And then left. And the left was not too bad earlier.
Right, but I think you're right. That looks better going right. That's good.
Okay, good. Okay, so next probably I will get her on her stomach and do some thoracic PA. Cindy, do you like a pillow under your hip?
Yes.
I moved them. Move that chart here too. There you go.
Okay, so we're gonna have you on your stomach. And how's that angle?
Okay.
Does it need to be lowered at all?
Are you asking me?
Yeah.
I have no idea.
It feels comfortable.
Yeah, it's fine.
I feel like
Yeah, I agree with you, Liz. I'd lower that just a bit. There you go.
see how that feels. Okay.
We
Just
moved.
lift up your feet and I'll slide this pillow underneath. Okay, so let me grab. See if I can. Okay, so I'm just gonna start just with central PA,
Great.
just to assess her movement. I'm just gonna start
Good.
low and move my way up. I do my PA a little differently.
Mm-hmm.
So Cindy, let me know. I'm just looking for movement at each segment. We've done this before with you a lot, but let me know how it feels if you have any problems.
Party.
She's really stiff, even low. So starting with HVLA, I think I need to loosen her up a little bit before we get into.
Yeah, and with HVLA, I mean, this is there's a lot of good things with that. But this is a little bit more of a chronic.
Right.
So you probably do have more myofascial restrictions, more hypomobility, maybe a larger segment instead of one area.
Yeah.
But don't discount that too. I mean, I think sometimes we say, oh, I'm not going to do HVLA because it's more aggressive. But when you really think about mobilization in a prolonged period, that could actually be more aggressive after 15 minutes than a quick get in, get out.
Yeah.
Yeah.
Yeah, she gets really stiff upper.
Now, Cindy, as she gets closer to that up higher, let her know if you have any discomfort in the neck.
Okay. And it doesn't hurt, it's just stiff.
Okay. That's great. That's we want to stretch it a bit, so that's good. And you're also doing treatment while you're there, which I like too.
I'm just gonna kinda
Assessing,
hang out here.
treat, exactly.
Yeah, most stiff about T2 through 4, I think.
So same thing as you're treating, think about exercises you can do to help her mobilize at home, and things she can follow up on to maintain that.
Yeah.
And Cindy, one of the things we want to watch too and get feedback from you is as you're sitting and typing, can you do it longer? Is it more comfortable? And then in between, things you can do as well to stretch, like you said, or work on your posture so you don't have discomfort.
Okay.
you hear it, Cindy?
Jamming. Good.
That's definitely a spot right there. So that would be where I would choose to do HVLA, I think.
Good. I
Is
like
right
that.
in there.
Yeah. And you know, that's far enough away from her surgery, and we can localize to that. And it's amazing, Cindy, you know, if we can loosen this up again, I really think it'll make your neck feel better and take stress off. And when she says HVLA, she's talking about trying to get your back to pop. So if you're not comfortable with that, we absolutely won't do it.
I'm fine with it.
Okay.
Get it?
Yeah, surprisingly, she's not as stiff right at the junction.
Yeah.
Where I would have guessed.
Right. More through there.
Mhm.
Yeah. All right. So, you know, you can also assess first ribs here. You know, sometimes I'll do that. What was hers to her left? Yeah. So when I do that, you know, I'll come in and just try to glide here. And sometimes, you know, and yeah, boy, she's definitely stiffer there. So, you know, I try to again support the neck. My angle of mobilization is through here. And I like this sometimes too because I feel like all the muscles can relax, or I can kind of get the upper trap out of my way. And then it's easy on me. I don't have to climb on the table. The hard thing with this though is it's to reassess, I have to set her back up where the way you do it, you can reassess immediately. But that doesn't take much. Is that pretty tender, Cindy? Yeah. Doesn't take much to get that loosened up, so that's nice too. Okay, so how do you think you want to try and do the HVLA?
I myself prefer supine just because I'm more comfortable with it, and the sitting is sometimes hard for me, so that's probably how I would do it, just making sure neck's supported.
Absolutely. So set up here, Cindy, would you? And let's try that.
I'm going to have to get a taller step.
Okay. Yeah, will you pause that real quick and we'll...
Okay, so I'm going to have you on your back, head down here, and on the very edge of the table here. Okay, so just get that just under her head.
Good. Are you back to work full time?
I'm teaching part-time and then the nonprofit after.
Good.
I love it. That's fun.
Yeah, that's nice.
Do you teach in the summer?
No, I'm not doing summer school, so right now it's just the Opry.
Okay. So I'm going to put this right here and have you cross right arm first and left arm over right. Just like that.
Okay.
Nice and tight there. Okay. And if I push through your arms, is that okay? Okay. So I'm going to roll you towards me.
I must have my keys.
Okay, so I think it's about right in there.
That look good.
You okay there, Cindy? So I'm going to have you take a deep breath in and out, and then we've done this before, so I know she's comfortable with it, familiar with it.
Good.
But normally I would say, you know, at the end you may have a little pop. Is that okay? Yes. Okay. So go ahead and take a deep breath. And then all the way out. And there was a little teeny click there.
Good.
Do you want to feel that, or
Yeah, you want to?
you might?
And you know, I definitely have an advantage in that I've got a bigger reach. And with this towel here, sometimes I like to do it like this, and then you know really tighten you up. Does that feel okay on your shoulders? Okay, and then same thing, roll towards me. I use an open palm and do that. Is that how
Okay.
you do it?
I do this, but
Yeah.
I
Yeah.
sometimes bothers me.
Right. Exactly. All right. So same thing, Cindy. I'm gonna try and really get you bound up here.
Okay.
Does that feel okay? All right. Same thing. Big breath. Take it Good. All right. So let's sit up. Why don't you face Liz and let's reassess real quick too. So I don't think I did much different on that manipulation.
I think just the fine tuning,
Right.
skin locks, and that.
Right. And I think just before the thrust, that's that movement.
Mhm.
Right.
Yeah.
Exactly.
And I know this is very subjective, but I do feel like there's a little bit more give there.
Good.
I guess the true test will be her range of motion of the neck,
Exactly.
but definitely on that right side too, because that wasn't what
Mm-hmm.
did there before.
That's good.
So that does feel a little better. So we're gonna go back to those the range of motion. So look down first, and then up to the ceiling. Good. And that may even be a little more there, that extension. Okay, back to me, and look over your right shoulder. Good. She did not flinch. So that was an
That went
improvement.
further.
Yeah,
Good.
definitely further. And then look to the left. She actually almost has more movement to the right now than she does
Yeah.
to the left. And then right ear down. Good.
Yeah, that's better.
And left. Good. So that is still probably the most
Mhm.
limited thing,
Mhm.
is that left side bending.
Yep, I agree. So let's do a couple of exercises to reinforce.
Mm-hmm.
So what do you want to do for neck and then thoracic?
Well, I think for her, for the neck, doing like the flat ball, well, we need to do the deep cervical
Good.
retraining, and then maybe some flat ball range of motion.
Good.
And then for thoracic, definitely posture.
Good.
Maybe posture at the wall.
Good.
Maybe even out of TheraBand, and then I would do a towel mobilization. Either probably horizontal
Yep. I
with
agree.
her, and have her mobilize right over that 4-5
Great.
area that we manipulated.
Great. So let's do, why don't you, the last thing we'll film is why don't you teach her the deep neck flexor exercise and then we'll stop with that.
Okay. Do you want me to do that with the stabilization?
No,
pad?
let's do first time, let's just, are you okay just doing it like this?
Yeah, just go ahead and lay back on your back again. Let's start without a pillow and see.
Yeah. And if she needs a little towel or something under there for feedback, we can do
I think
that.
your pillow would be too much, but that looks pretty good. Is that comfortable? Okay. So for this exercise, we're trying to work on those, we tried to work on mobility lower,
Right.
and now we're trying to work on stabilizing here. So you've done this before, but we're going to really make sure you're doing it correctly this time. So,
Okay.
But you have done this before. It's like the chin tuck exercise or the chin nod.
Okay.
And that's the movement, and your head's going to stay on the mat, and you're just going to nod that chin down just a little bit. Good. So you should be activating these muscles right in front, and that looks really good. She, like I said, has had a lot of practice.
Yeah. And that does look really good. You know, she's kind of, we
She's
might
going off to
check,
one side.
yeah, OA and AA, because she is kind of like this.
Mhm.
Yeah,
Okay. And
Yeah.
with her right here, that's really easy to check. So.
exactly. So what I'm saying is, do your nod one more time. You're kind of like this. So you're kind of moving better on this side than this side.
Okay.
And it's above the surgery, so Liz is just going to assess this upper part here.
Okay.
Good. So just stay relaxed. So I'll just start in. Yeah, it's tight.
Yeah.
And then I'm gonna go off.
And you can tell that just from me moving my chin.
Yeah, isn't that
That's
amazing?
bizarre.
Because it didn't go symmetrical, it kind of
Yeah.
went to one side,
Oh,
so
okay.
one joint moved better than the symmetrical one, than the
That's
other
wild.
side.
So right here I'm checking that left
Mm-hmm.
and it is moving a little bit.
Mm-hmm.
And then when I come to the right, it kind of is blocked compared to that left.
Exactly. So you can mobilize right there,
Mhm.
and then once we watch her do that exercise again, let's make sure she kind of self-corrects and comes
And
down. Yeah.
relearns. Because she probably hasn't done this
Exactly.
since
Oh, wow.
2009.
Right.
Yeah.
Can't believe it's been 3 years.
Yeah.
Crazy.
That's good.
But yeah, that's,
Mm-hmm.
I'm working to get her.
Yeah, to get her there.
Yeah.
Yeah.
So then I'll go back to the middle.
Good.
So there I feel like I can get a...
Yeah. And I like your hand hold. It's very gentle motions, which is good. Because you can blow right past that joint doing too much. Alright, so now let's look at you do that again, Tut.
Now I'm not.
No
I know,
pressure.
now you're nervous,
So
aren't you?
conscious.
Huh? Good.
Good.
That's a lot better, isn't it?
Mm-hmm.
Give her just a little bit of tactile cueing to
Okay, come out of it and then go ahead and...
there.
There, yeah.
Can you feel that right there? Stretch.
I don't know. Yeah.
That looks a
Okay.
lot better. So
Come
come
out
up
of
and
it.
yeah.
I'm kind of just...
There you go. And you know, we could even have her rotate to the right a little bit. So kind of come look at me here and just rotate your nose right there. Now tuck.
kind of do an active
Mhm.
mobilization.
Yeah, let's do a few of those and then come back to center and do your exercises.
Yeah, I've never done that before. That's
Yeah.
good.
Because I just don't want her doing it, you know, tilted the other
Yeah.
way.
Mm-hmm.
So this will kind of let your body know, okay, I can do this, and then, okay, now go back to center and try and we'll see how that looks.
You know.
Sorry, I
Yeah.
was just trying
No,
to
that's
find
okay.
my
I
center.
wanna-
Yeah, exactly. Good. I try to find my center all the time.
Mhm.
That actually looks a lot better.
Yeah, it does. And that's no cueing
Yeah, that's
that third
good.
time. So.
So when you do this at home, start by laying down, rotate a little bit to the right, try to feel it stretch on that right side, and then go back to your center and do a few more.
Okay.
Good.
And when you're in the center, hold it
Yeah.
about 10 seconds.
Okay.
When you're doing it off to the right, it's more of just a movement, so you can just kind of come on and off 5 or 10 times.
Yeah, I do feel that.
Yeah, there you go.
Yeah.
Good job. That, because that's what, when you can feel it and self-correct, that's perfect.
Okay.
That's good. All right, that's good. Okay, so just a real quick follow-up with the mentoring session. I think that was great treatment, excellent sequencing, good test, retest. With Cindy, I can tell she's going to push this, so she probably needs education of what not to do as much as what she can do. And typically with someone like this, I do pain education, but I can really tell just from working with Cindy, she doesn't have much fear of anything.
Right. Yeah, definitely not avoidance.
Right,
Yeah.
right. And my thoughts when I looked at this was we were probably going to have to do patient pain education, but now working with her, I'm almost on the other end of that, avoidance activities. I think she really needs to be careful with that because she does hinge at that 5-6. And you might even see if you can teach her how to retract and then look up, if she does have to look up instead of that.
Okay. Yeah.
Yeah, yeah.
Yeah. And even getting up from her chair, you know,
Exactly,
that kind of stuff.
exactly. And then like I said, just educate her. It's not completely healed yet. You know, it's not very careful lifting overhead, anything like that. But not to scare her, you know, but just say, be mindful of this, give your body more time, you know, and then we'll gradually get you stronger so you can do that.
Yeah. Okay.
Anything else?
No, I think just posture is going to be very important with her job.
Yes.
probably pretty weak, so we can go ahead and start hitting that now.
Absolutely, absolutely.
So
I think that'd be
that,
great.
and then just stabilization during everything. Instead of just supine stabilization, we've got to teach her how to do it sitting, standing, reaching, all that.
Perfect. That's great. And then prognosis, how do you think she's going to do?
I think based on just that reevaluation, I think very good. We're able to change that rotation in 10 minutes. And, you know, just knowing her, she's very compliant, very not avoiding things.
Exactly.
So activity is going to be increased. She's not going to just sit and let it take over. So I think good prognosis.
Good. And how long do you think you want to see her?
She started about 8 weeks after surgery, so I think about 6 weeks, and then we really need to reassess and see if she can manage this on her own.
Good, good. I think that's great. All right. Good job.